Transition 2 is designed to expand Medicaid eligibility to the 62,000 Idahoans in the healthcare gap.
If you go out to dinner tonight and sit down at a restaurant, chances are the waitress, the waiter, or the hostess, the cook in the back probably fall into that income gap.
But Malloy says it's not taxpayers' responsibility to support medical costs of able-bodied adults.
Adults who could probably work. Okay, I don't think that's necessarily the core group that we need to expand this program to.
The expansion addresses Idahoans under 65 years old who make too much money to qualify for Medicaid, but too little to qualify for health care subsidies. If it passed, Idaho taxpayers would pay $42 million, and in return, we'd receive $400 million in federal money to help pay for the health care of the uninsured.
For a dime, we get $1 to take care of people right now who are uninsured.
I think my taxpayer dollars should be focusing on the roadways, should be focusing on the schools.
Due to the Affordable Care Act, support from federal funding for the expansion slightly decreases with time. For instance, federal government would cover 94% this year, 93% in 2019, and 90% in 2020 and subsequent years.
You can either pay a little bit up front for preventive care, or Idahoans are paying for the more expensive, very inefficient care that they get when they come when they're in crisis.
I don't think it's right for me to expect somebody else, regardless of how much money they have, to pay for my medical costs.
Where it stands now, 33 other states have voted to expand Medicaid. As a reminder, Idaho voters may register in person on November 6th. Live in the studio, Madeline White, 6 on your side.